Mansfield today on a Wednesday, and that means that we go into things medical. Dr. Vicki is our resident GP. Hello, Doctor.
Hello, Jeremy.
Are you well?
I'm good, and you?
Yeah.
So.
You know, even with all this rain that we've had and that, as an allergy sufferer, I'm sickling. I really am. And I know other people that I know who have allergies are also sniffing and snorting, and even now as I'm speaking, I can hear myself in my ears because
nasal,
yeah, it feels like everything up here is still bunged. And you know, I feel sorry for people who have allergies like that, but I was also thinking, and that's why I phoned you and said, let's maybe talk about this particular subject. When you have all these things in the air, does it affect asthma sufferers as badly?
Yeah, in a big way. So I've seen a hell of a lot of allergy patients at the moment, and obviously if you've got rhinitis or sinus problems, it often because your airway is made out of the same cells all the way down into your lungs. So if you've got a problem with the nose, you can often develop asthma even if you don't treat the nasal symptoms.
Oh, really?
But the asthma people, the asthma patients, they definitely are a bit out of control at the moment as well.
Yeah.
So I find it interesting to look at all the different asthma, like the devices. You get so many different devices, and I've seen patients use their little asthma pump sideways, upside down, stuff coming out their nose, and they wonder why their asthma isn't controlled. So I think it's a very important little topic to just quickly touch on, to make sure that you know which device you're using and exactly how that device works.
Well, I see you brought in a whole lot of...
I've got a few.
Yeah.
I've got a few. So you get the pressure meter dose inhalers. Those are the, and I haven't got one of them here, but they're the normal ones that you just depress the little canister. Exactly, yeah. So because they're pressure metered, with every time you compress it, it gives you a dose.
Yeah.
Okay. But now it doesn't help you swallowing the medication or, putting it out there or doing 2 puffs at the same time. So the way you should do it, number one, you should take the cap off.
Yes, okay, that's going to help.
So take the cap off, and then you need to shake all of these MDIs. You have to shake them. So that the drugs are equally dispersed through the canister. Then you're going to exhale all your air out of the lungs. You're going to then position this in your mouth with your mouth closed over it. And as you start inhaling, only then you depress once. So you're going to start inhale.
But now hang on.
Yeah.
Is the little, the bottle,
yes,
is that up or is that down?
It's up.
It's up.
It's up like this. This is sort of similar. It looks similar. So it's up.
Okay.
And
so
the mouthpiece is down.
The mouthpiece is down.
Yeah.
And you start breathing in.
Yeah. You start breathing in, and then and you breathe in completely, and you hold it for, if you can, for 10 counts, and then only do you exhale. And then if you need 2 doses, so often you need 2 puffs twice a day or whatever. You won't do 2 puffs at the same time. You'll do your one, the whole cycle with the counting to 10, exhale, then you wait about 30 seconds, and then you do that whole spiel all over again. That's important.
Okay.
So they come in different colors, different drugs, different pharmaceutical companies make them, but they really all essentially work the same. So those are the relatively easy ones that are when you have babies or children or even adults that really can't get that coordination right. You can use something called a spacer, and there's different shapes and looks, but this is like, for example, for a baby, it's got the hole here where you would put your asthma pump, you'll put it in there. Okay. And then, so this just creates a bit of extra space between your mouth and the medication. So if you were now a baby, because you... Stop crying, please. Shut up. So then you'll put it over their little mouth and nose, cover them nicely, and then you'll do 1 compression. And then the baby, you'll let them breathe about 5 to 10 times. And that's one little dose. Oh, you're such a cute baby.
Thank you, Mama.
So there you get different
Mama,
types
ek
of
is
spaces.
honger.
Ek gee nie om nie. I passed that stage. So some of them look like water bottles even, you know. So you can use a spacer if you need to. Then you get the powder devices. They normally need to be primed. Okay. I haven't got all of them here. I've got 2. So the one, I think they're going to go closer. The one is called a turbuhaler.
Okay.
And basically you have to unscrew the cap. Okay. Take the cap
Lucky
off.
you brought the right thing in there, Vicki.
Now this is that needs to be primed still.
Oh, okay.
So you're going to hold on. You're going to twist it to the right, and then a click when it comes back. Okay.
Yeah.
Now it's ready. Okay. This one you're not going to shake and drop and put upside down or anything like that. You're now going to do the same thing. So you're going to exhale. You're going to put this in your mouth. I'll demonstrate if you'll zoom out a little bit. You're going to exhale. These powder devices you have to actually inhale quite deep and fast. Faster than the normal.
Okay, Jared is jumping all over the place. I don't think Jared's following this one here. His thoughts are in a different place, to be honest.
So you will exhale. Yeah. You'll put your mouth over this primed device.
Yes. Oh, yeah.
And then that's done.
Okay.
Then, okay. If you need another dose, you're going to now prime it again.
Reprime it.
And do the same thing.
And put it back
That's your turbuhaler. Okay. And then another device, and I'm not going to show the inhalation again because Jeremy's getting excited.
Let's put this down because otherwise it looks like something very...
Then you get the turbuhaler. So this looks like a dischaler.
Is your mother watching this show?
Anyway, so she's also got asthma, so she knows. So this device, like we say, we have to open it, and you still have to prime it. So there's this little lever here that you're going to push down. Then now it's ready and primed, and then you're going to go through. Exhale, put your mouth over, inhale deep and quite hard, count to 10, and then
what activates that to come out?
The sucking action.
So you've actually got to suck quite hard on that to get it. So you needed to hear it go thunk.
Yeah.
Okay.
Okay, and then you're going to close it, and then you're finished with your dischaler.
That's quite a handy little thing to keep in your handbag.
You can throw someone with it as well. But it's very important with these powder devices, and we sometimes forget to tell the patients you need to actually rinse your mouth and spit out the water afterwards. Otherwise, you can get thrush at the back of your throat because the powder can stick there.
Right.
There's a breezhaler as well, but I don't have a breezhaler. Then you get the elliptahaler. Now this elliptahaler is quite a cute device.
Determined to make that look like
so
a special
the elliptahaler is also a powder device, but it's going to prime itself as you open the lid.
Okay.
So as you open, you hear a click.
Yeah.
And now it's primed. Okay, so there's the mouthpiece.
And
so then you're going to do exactly the same thing. And you just close it again.
But that's also a powder.
That's a powder
Okay,
device.
so once again, rinse your mouth.
Exactly.
Is it necessary to gargle?
I think so. I think you must gargle. Yeah, I would. Yeah. And then you get other novel techniques. I mean, that just shows you already. I'm confused if I was a patient.
Yeah.
Okay, so it's very important to try and stick to the least amount of, don't give them all different devices, or if you do have different devices, make sure you know how to use it. You get a Respinat aspiriva. It's basically produces a soft mist. And you actually put a little capsule in it. Some devices you can use a capsule and you have to puncture the capsule and then inhale. But that soft mist, gentle mist, is usually for people that don't have enough lung capacity to actually inhale so sharply, like COPD patients, emphysema, so it depends. And then there's, for example, the Synco Breathe inhaler. So it's just a completely different, There's nothing to push on. So that's important to, for example, because it looks like a
Yeah, it does look
MDI.
like, yeah.
So the patients open it and they go like, where do I push? You know, it's important to tell them there's nowhere to push. It's activated by, it's breathe activated. Very clever. There's a
Okay,
little,
so once again, you put it in and
Yeah.
you breathe in.
yeah, there's a little flow sensor in the mouthpiece.
Okay,
And as you start inhaling, it activates
right.
the device. So that's that one. So that's why it's just so important to,
That if you are diagnosed with asthma and the doctor puts you on a certain type of medicine, to check with the doctor how you should use that medication.
you know, we sometimes also, what happens is patients come to you already on asthma medication and their asthma is out of control. And I sometimes forget, you know, so it's important to actually then maybe ask the doctor, am I actually using this correctly? Because even if you use your medication twice a day, every single day, and you don't use it properly, that medication doesn't get to the lungs. It's not like swallowing a pill and then that works, you know. If your medication doesn't get into the lungs, you're not going to be able to treat your asthma properly. So, yeah.
Okay, Dr. Vicki, jy kan jou trommel goed
That was
wegvat
fun.
asseblief.
I feel so clever when I can work all of these things.
Thank you very much for joining us once again.
It's a pleasure, Jeremy.
Dr. Vicki Skitter, our resident GP, right here on Mansfield Today. Thank you for joining us. Till next time. Bye-bye.